There were times as a low income earner, you feel that you might not have the available funding to pursue the healthcare that you do require as an individual. And I found that very discouraging. But over time, I realized I do have access to these resources and the ability to connect myself to them. I had the funds already available, they were already there for me.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flesky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Jenelle has worked in healthcare administration for 5 years. Her favorite part about her current role is being able to connect with members who don't understand their benefits and being the catalyst to bridge the gap between confusion and understanding. And I think that captures the spirit of our podcast in a nutshell, Jolene.
I agree. Welcome, Jenelle. We're happy you could join us.
Hello, ladies.
Today we want to talk to you about health savings account, or our favorite acronym, one of them, HSAs. So you said one of the biggest lessons you've learned since entering this industry has been learning how to maximize your HSA account. So let's talk about that statement. What do you have to share around that?
So I believe that I provide a very unique perspective to the health insurance industry, just through my personal experience as a consumer, and then now having been involved in the industry through employment. I've definitely had a lot of opportunities to gain more awareness and insight into what it means to carry health insurance and use it for your own benefit. I feel like a lot of times when members are potentially enrolling in new policies, there may be some confusion, or you can feel sort of oblivious to what you're actually signing up for. And, as a care navigator for Nova Healthcare, a lot of the inbound calls that I'm receiving are just, what is my health insurance? What is a deductible? What is a health savings account? What does an HSA stand for?
So what is it about an HSA that you appreciate now that maybe 5 years ago wouldn't have been kind of a light bulb moment for you?
So the question is, or the question proposed is great. What I want to reference most importantly is contributing to your HSA consistently. I previously was employed through a separate entity as a pharmacy technician. And during that time, as I was accumulating my HSA, I didn't even know where that money being removed from my paycheck was going. It was just something I had signed up for, like the rest of the people, just signing when they tell you to sign, and it wasn't until after I had been employed at Nova Healthcare that I began to learn more about these health savings accounts, that I was able to recognize that I had an extensive savings in a separate bank account set aside for me to utilize for medical purchases. Not only that, it had been accumulating interest after sitting for a year or so, 2 years. And, I was able to gain greater access to healthcare. There were times where maybe as a low-income earner, you feel that you might not have the available funding to pursue the healthcare that you do require as an individual. And I found that very discouraging. But over time, I realized I do have access to these resources and the ability to connect myself to them. I had the funds already available. They were already there for me.
That's so interesting because when I moved from a different employer to Nova, I started with a just like your traditional copay plan where you paid X hundreds of dollars per pay period into the plan. And then when I changed to the high deductible plan, it took 3 years of convincing by my colleagues who did math every year at open enrollment. They were like, do you understand what the cost is? So take all the dollars that you spend out of your paycheck for the copay plan and add that up. Now imagine if you took those dollars and put all of those into the HSA. You're paying the same for your health insurance out of your paycheck. You're not going to know it's missing. Just put it in there. So I started to do, they would just trust us. And I did, and it was the same experience that you're talking about. You don't think about really using it or where those dollars are going. And I don't want to say missing them like I couldn't use them differently, but I was going to have to pay that dollar amount for the traditional plan, but now I was moving those savings into an account that I could use at my discretion. So yes, it's a high deductible plan and there's more out of pocket up front until you reach that deductible. But now you've got, like you said, this money in a separate account that you can use for those things. And some years are better than other years. So the years where you're saving, you'll have that money accumulated to be able to spend when you need it. It took a long time for me to get there.
You're definitely not alone. And like I said, even the inbound calls that I'm receiving are very similar in nature, although, HSAs would not be my corresponding department. I do sometimes have to provide that understanding. But yeah, and then additionally, to know that that's being removed pre-taxed from your paycheck, you're not only maximizing that, tax deduction. When we talk about New York State residents, we know how harmful that can feel sometimes,
Yes.
But yeah, it's become so impactful in my personal life when, choosing not only my healthcare plan, but, what healthcare treatments I'm comfortable fulfilling or pursuing and what is actually available to me, monetarily speaking. I now have this whole separate account of funding that's been backed for years now, and I continue to contribute. And I found it so impactful to me directly.
So I love your perspective on HSAs because I feel like it's a hard pill to swallow when you have a high deductible plan.
Of course. No, I absolutely agree. And, previously, I've also stated that even just going through the employment process of learning, how to prepare for my interview with Nova and what am I going to have to say to actually get the job, I was able to acquire various resources that were educating me on how to proceed forward in the industry that I maybe wouldn't have researched without that prompting, So I'm going on YouTube and I'm searching what's a high deductible plan. I found this podcast, a long-time listener, first-time caller, but it's just funny how things go full circle. And then now I'm acting as an advocate for my friends and family, get signed up as soon as you can. It's so helpful. When you're in need of these resources, it's hard to know where to turn to. And that's why I love the position that I found myself in where I am that resource. People get to call me and I get to do the explaining, That's really such a bright area of my life. That's something I love to do. And, I also talk about, advocating for patients and making sure that people know how to find these resources that are available to them.
Thank you for sharing your insight.
Yeah, your experience is, I think, one of the things that makes it easier for people to call Nova. And I hope that your passion for wanting to help people inspires other people to actually pick up the phone and call their benefits administrator and ask questions, because there are people on the other end of the line that really do want you to have a better experience and help you understand your benefits so that you can really get the most out of them, because it's a bendy world out there. We can use all the help we can get.
No, that's absolutely right. And I feel like we're so lucky to be where we are. I mean, I understand that, health insurance is its own monster of an industry. It's a lot to take on in and of itself, but we do have access to these health treatment resources as well that we should be utilizing and, knowing how to access those and reach out for support when we do need it and where to turn. And if you have a question that's being posed that you're not sure how to answer, I can guarantee you there's a paid professional somewhere who's already done it and would love to help, And it's just so comforting for me to have this experience in healthcare because I can also translate that to other areas of my life. If I have a problem with my car, there is a professional I can call,
Yeah,
I'm
let
sure
them
you
help.
understand.
Yeah. This is great. This is so great. I'm glad you could join us.
Oh, of course. Yeah, like I said, happy to join.
Thank you.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.